What is a dental implant and why should you care? Hi, I'm Dr. McRee with JAX Implants today, and I want to talk about dental implants. We talk about these full mouth dental implants and All-on-4 and All-on-6, but we really don't talk about is an actual dental implant and what it is. Well, what a dental implant is basically a screw, and it goes into your jawbone. And it's very similar to plates or knee replacements or hip implants and all that stuff. They're all titanium, and that's the body loves it and it works very, very well. And so it's the foundation of which we build all of our teeth, whether it's a single tooth or a whole full mouth of it. But I really kind of want to get into today is just very simply what it is and how it works. So it's a metal screw, and it's made out of titanium. And it can be made out of a couple different materials, mainly pure titanium, which is what we use here. And I like it because since it's commercially pure, it has no trace metals. So there's no allergies, there's no rejection issues, that kind of stuff. Some manufacturers use some alloys that can make the implant slightly stronger, but then you can have some issues of rejection. And I'm not trying to scare them and say that's gonna happen a lot, but having trace metals that's not pure titanium can cause something like that. So anyway, here at JAX Implants, we use pure titanium. So worth asking your provider if that's something that you're interested in. But how does it work? So it's basically like a wood screw. Kind of sounds funny, but that's kind of what it is. I actually grew up, my dad was a nails and staple salesman, so I've been around screws and fasteners my entire life, and now I do it in someone's mouth. But it literally is threaded like a wood screw, right? And so it goes down into the bone, and you're like, well, the bone's solid? Like, how does that work? Well, bone's more like coral. And so it's not as dense as you might think all the time. Some areas are a little bit more dense than others, but basically there's good blood supply in there. So it threads in there, and you make it kind of similar to putting, like hanging something on a wall, right? You make a pilot hole and you actually put the screw in there and actually thread it in there, like hitting a stud. So it works very much in the same way. And what happens is the screw right here looks smooth right here, and I know this is just a model, but what makes an implant special is that it's very roughly treated on the outside. So like microscopically, and we'll show you on a graphic here, like when you zoom in, what happens is that threads into the bone. Well, that gives you initial primary stability. And so that's why it's enough to hang a picture on that day. And why we wait usually a few months to put a tooth on top of it or wait till full chewing is because that wants to grow in around that rough area. And so microscopically, what happens is your body thinks of it like its own root. And as you can even see, it's replacing that root. So obviously your molar has 2 roots or 3, depending on where it's at in your mouth. And usually all of your front teeth have 1 root. Well, even the back teeth, we just use the 1 implant right here. So it goes in and every little microscopically grows in around that implant. And so at that point, it's just like your root was. And so basically we're just trying to replicate what the natural body is already doing. And so when it grows in around every little thing, you couldn't get that implant if you wanted to. Obviously there's ways we can remove implants if we needed to, but typically, that's not necessary and that's not why you're doing it. But once that's in there and integrated well, and if done well, that acts to replace, again, what the root was. And then we can put what's called an abutment and a crown, and basically that's just your teeth. So obviously this is how it would go on a natural tooth, and it would slide right over and go on a single tooth. And you can expand upon that, and obviously we do it across the entire bridge if we're doing 4 to 6 implants and replacing your full mouth. But that's the very basics of what a dental implant is, right? It's pure titanium, it's threaded like a screw, has a very rough surface, and then it's osseointegrated, which means bone integrated into the bone. So that way, when you're chewing on it, you don't have to worry about anything. You can't break them. They're super strong. It should last you a lifetime.